Hi, class. Next week is spring break, so you guys don't have to do anything next week. I'm going to be trying to line up my school psychologist and social worker for us to talk to during break so that when we get back, you guys have something to do. Today, we have Reema Maya with us. If I
Yeah.
remember, it's hard to say, but it's got a lot of A's in it. Um, but she is a candidate in a forensic psych program at Alliant
No, I'm
or
at the Chicago school.
at the Chicago school, sorry.
Yeah,
Um,
that's okay.
and so what we're going to do is we're going to kind of hear her journey and her path and ask her lots of questions about forensic psychology. So introduce yourself.
Hi, my name is Reema Maya.
And
And
then, hey,
and I started my college career at Cuyamaca and Grossmont. Weinert was my first psychology professor, and I actually was not sure if I wanted to go into psych, and then he actually told me about forensic psychology, and that's when I got that link between law and psych because that's what I was juggling between. And then I went to SDSU for my undergrad, took a forensic and abnormal psych class there, and that's when I said, okay, this is exactly what I want to do. Works perfect. And COVID happened my senior year of undergrad. And so I was kind of like, okay, what do I do? And then I was looking for programs that did forensic psych. There's not a lot of schools that have forensic psychology specifically that is accredited, and I'll clarify that later. And so I found the Chicago school, and they have a master's and doctorate program in forensic psychology. So I applied, got in, and now I'm in my third year. I'm technically finishing my classwork this year, and then I just have internship and dissertation to finish, which is really nice. The
okay, so
experience I have, yeah.
explain what kind of school the Chicago school is, because it's not a traditional university
Mhm.
kind of thing.
Yeah, it's a private school, and so it was primarily just focused on psychology. Now I think they have a nursing program, but it's a private school. There's no I know there's a lot of doctoral programs that pay you to go to school. This one is not one of those. So it's that kind of school. Yeah.
Okay, but that so there's so if you don't, do they just let everybody in who has the money to pay, or is it a still a rigorous application process?
So I actually had to write an addendum because they weren't going to accept me. And then I wrote an addendum and then they did. I have friends that applied and did not get
Okay,
accepted,
so it's
but
not
yeah.
just a if you have the money you can go.
Yeah, but I think it's definitely easier to get into, that's for sure.
Yeah. Okay.
Yeah.
Can I ask how much it costs?
I can tell you I am $190,000 in debt right now at the end of my third
Yay.
year. Yeah.
Okay. Yeah, okay. So it's not for the faint of heart.
No.
But okay, so what is your typical day like in graduate school here?
Yeah, so it differed from first year to now third year. First year, I did not have to worry about practicum, which is something you have to do when you're getting your doctorate. And so in my third year right now, what I'm doing is what's interesting about this school is classes are on the weekends. So then you have the week to work at your practicum site. So I work at a federal center. It's called the Los Angeles Job Corps. It works with the federal government. It's a trade school. And so I provide therapeutic services and do assessment testing on individuals aged between 16 and 26. And I work there on Mondays, Tuesdays, and Thursdays. And I have a caseload of 15 students. And then I have like 3 or 4 assessment students. And it really varies week by week how much I actually work, but it's those 3 days. And then I take 5 courses each semester, excluding summer, which is just 2 courses.
Wow.
Yeah.
So explain what it means when you have assessment cases. What does that mean?
Yeah, so I right now do a lot of intellectual assessments. Like we assess for ADHD and then some every once in a while personality assessments to help with diagnostic clarification. I have a client right now, very interesting client. She's got a lot going on. And I was like, I don't know if this is personality, if it's PTSD or whatnot. So we gave her the MMPI and then that's like a 500 question personality inventory. And so essentially we do the intake interview, we get all the background information about the client and then we assess them. If we're doing ADHD assessments, it's like usually the WAIS, which is the Wechsler Adult Index, I think, is that how it's said? Yeah.
Yeah.
And that just kind of looks at different domains of the brain and sees where their cognitive functioning and level of intellectual functioning is at. And then we'll do like um what is it called, like a self-report to see if like they have ADHD symptoms, and then we'll do other things like the Woodcock Johnson if it's needed. I had one client that had a very interesting presentation, And instead of actually being ADHD, we found out that it was like an executive functioning disorder, which is like that prefrontal. And so we found that by doing this thing called the DKEF's trail making test, which was something that I'd never done before, but my practicum site introduced me to it. And so that was really interesting. But it's really just what is their presenting problem and what tests can we give them that is appropriate to assess for that.
Okay, cool. So it's a lot. So how did you prepare yourself to learn this stuff?
Yeah, so at the Chicago school, and I'm sure all doctoral programs do this, we take assessment courses. So we took an intellectual assessment and we took a personality assessment course. And in those courses, they train you on basic assessments like the WAIS and the WIMS, which is those adult like cognitive functioning tests, and then children functioning tests. And then the personality assessment course was the MMPI, the PAI, and
Probably
there's
the
one
same
other I
thing.
can't remember, but yeah.
Okay. So MMPI stands for Minnesota Multiphasic Personality Inventory.
Yes. Yes.
There are 26 scales on the
Yeah.
MMPI plus subscales, depending on
Yeah.
which version you
I'm writing a report for that one right now. As of today, it's like 15 pages. Yeah.
And it's really cool because it's got so okay, so this is actually one of the things that we kind of talked about a little bit because Becca is veering on to the on the squishy side and you
Mhm.
are going toward the hard science side.
Yeah.
And
Yeah.
that's why like the degree in counseling, you do deep dive into psych theories, but you're doing a deep dive into like test validity
Yes.
and and reliability and statistics. And it's interesting how even though you're going and doing therapy, you're spending a lot of time doing math.
Yeah. Oh my gosh. And I don't know if you remember how difficult stats was for me, but
No, it wasn't difficult for you. You had motivational issues.
that's
You
true.
you guys you are the one that was able to do it, and Becca had to tell you what to do, but you were the
That's
able to
true.
one. So they would sit next to each other for the folks at home, and Becca was the logic person and she was the math person.
Yeah.
And it was she could just do the math, no problem.
It was
And
actually, yeah, you're right, doing the work. And I figured that out because I had to take two more stats classes in my doctoral program. And I was
right.
like, okay, Becca's not here to hold my hand through this, so I kind of have to do it myself.
But that's awesome. And so that's okay, so that's the assessment. That's a that's like a quarter of your load of work there.
Yeah,
Okay. And then the other half, so what kind of therapy do you offer? Or so what are these clientele like? So first of all, they're in
yeah.
the job course, so
So I'll backtrack a little bit. My first practicum site was at an inpatient psychiatric hospital in downtown Los Angeles. And
wow.
so that, yeah, that was amazing experience. I cannot lie, but that was very basic, like intake. What is this person going through? What are their symptomology? What type of psychosis do they have? Like, what are they dealing with? Because that was the population that we would really see there. Here, it's a lot of transitional youth, low socioeconomic status, homeless youth. And but really, those are the two bigger populations. A lot of them are African American or Black. And so we deal a lot with like, I see it as generational trauma, but more so just kind of like what the system is working against them and how they're dealing with it in today's environment, essentially. So some clients, I have like that cognitive behavioral therapy approach. Other clients, I have to have like a more humanistic therapy approach because they don't have that support system. And doing CBT is not going to work with them because they don't have that foundation. And that's something that I learned a lot in my doctoral program, especially working with people from lower socioeconomic statuses. If they don't have that support, they're not going to want to do CBT. Like they don't care for it. Like, why am I working on myself? I can't even like afford a house or an apartment or food. And so it really just depends on what type of therapy is needed for the client. So it really ranges. But usually I try and stick with CBT. It's the easiest and most simple. But that client that I did the MMPI on, I have to do like DBT, which is dialectical behavioral therapy, and humanistic with her because she's very like long trauma history. And that's when we're working with trauma, CBT also might not be the best because it really just depends on what's going on.
So like when someone has a lot of trauma, their internal dialogue is just not able to be reprogrammed very quickly. So
Yeah.
so dialectical trainings, you actually literally teach them to say things out loud, or is it yeah, because
Yeah,
they
for
have
her.
it has yeah. I learned that last year. I didn't know what that was. But
I learned it too, don't worry.
so okay, so when you get, so is there like a rubric or a scale or a um something that when you get into this population, how are you just becoming intuitive to know what works best, or is there like a rubric or a scale that you say, okay, this is likely to work, this is not?
Yeah, so I don't know if everybody does this at my practicum site, but what I do is I always give a GAD, which is the generalized anxiety disorder, and the PHQ-9, the patient health questionnaire assessment, and kind of just gauge where their anxiety and depression levels are. And then from there, I'll just start, I'll get to know them. We have like technically one intake session, but it really takes me 2 or 3 sessions to just figure out what's going on with the person. And from there, I'm able to gather, okay, this is their problem. This is what they want to fix. This is what I think they should also work on. And then I'll start gearing treatment that way. I'm going to keep using the same client with the MMPI for her. I started with CBT. And then after 6 weeks, I was like, nothing is changing. I need to do something else. And
Oh,
I'm
so
very upfront.
6 weeks, and in 6 weeks in, and she's is, so this is not an inpatient facility though. This is just,
No.
and she's maintained coming back for 6 weeks.
So the way that the Job Corps works is they provide housing for the people there.
Got it.
Yeah,
Okay.
because this client she's no contact with her family, and so she lives on center. She has no support, and so that's why CBT is not really working. And
Yeah.
so, yeah, so the ones that do come that are very consistent. I mean, I'm very lucky at this practicum site because if they don't show up to school, they get kicked out. So if they're on campus, they'll most likely just come to therapy because then they get to skip class for an hour. So it's kind of a win-win for them. Yeah.
Yeah. Oh wow. Okay. And so, okay, so then, so I'm still, I love the fact that you just jumped right into, oh well, I give him some more assessments.
Yeah.
It's
Yeah.
like I,
Well, when we discuss my future goals, you'll see why. So,
yeah, but I think, but that's, and because of what I know, I'm just laughing in my head about that because,
yeah.
but okay, so when you're doing, how much training, how many classes did you have on like how to do the therapy or how to do like CBT or?
Got you. So my first semester, don't ask me the names of them. I don't remember them at this point, but I took like an interviewing class, which is that intake. Like, what are you doing during your intake? And so we spent um 14 weeks on that. And then I took a specific CBT class. I've taken a
Oh,
family
cool.
systems class. Yeah. Um, like the way that the program works is I think each semester we have 2 classes that are focused on a different type of therapy, and you're just talking about that for the entire semester.
Okay, so for the folks at home, please pay attention. When you're going to a PhD program, because she ain't, you take a concept and dive deep, deep, deep into the concept. When you take a PsyD program, which you is, you take a practicum and you dig, dig, dig into that practicum. So there, you get to the same kind of place at the end, but the road is very different.
Hmm.
And so when you think about what Becca was talking about with you guys at home, not you, but what she was talking about is what they take like Maslow's hierarchy and dig all the way down into every single tiny nuance of it. Reema's like, blah. Tell me what I can do. I love it. But I mean, it's funny because she said the same thing about, well, you can see where this person is on Maslow's hierarchy and they need a lot of basic love and support. You said the same exact thing, except you said, oh, they need a more humanistic approach to therapy. It's
Yeah,
it's the same. It's just a different angle and a different way of looking at it. So it's really
yeah.
cool.
That is pretty interesting. I don't talk to Becca enough about work in school. We talk about other things.
Well, that's important. You do enough work in school to do work in school.
That's
You
true.
you
That's
don't
true.
have to talk shop when you're not working. That's why no, she just drew a normal distribution with an arrow through its head, like
Yeah,
Steve.
right.
Anyway, I don't know why. I just did it. Okay, so you've got one more year left,
Hmm.
right? Okay, and
Yeah.
so and when you finish, you will. So your dissertation
Hmm.
is it like a regular doctoral dissertation, or is
I
it,
believe so. Yeah.
yeah, is it research based or experience based?
It is research. I am currently in IRB, so I can actually get approved and start collecting data.
Oh, excellent. Okay,
Yeah.
cool. Okay, so it is a real, So I've heard a lot of PsyD programs don't require a dissertation that is research based, but
Yeah.
usually they're practicum based. So that's really cool.
Yeah, I think it's because my program wants to be the first APA accredited forensic psychology
Got
program
it. Got it.
because
Got it.
there's no
Okay.
APA accredited forensic psychology programs. Yeah.
Yeah, usually they are. Okay, so okay, explain what explain what forensic psych is. Okay, so what exactly is it? Because it's
So
not
yeah,
criminal mind.
forensic psych is like this weird integration between law and psychology where the populations that we mainly work with are within correctional settings or like in court settings, right? So that's why I wanted to do that first practicum site at the inpatient hospital because I would go to probable cause hearings and I would get that experience with working within the court system.
What does that
So
mean? Probable.
yeah, so when people are 5150'd, which is involuntarily admitted into the hospital, if they want to leave, they are offered a probable cause hearing, which is when essentially they plead their case to a judge, they have their own lawyer, and they're like, I don't need to be in the hospital because I am of sound mind and body. And they look for three things. They look, do you have a roof over your head? Are you able to put clothes on your body? And can you feed yourself? And if they can prove that they can, then the judge is usually like, okay, you can go home. But then also they interview the psychologist and the physical therapist and the psychiatrist. And so we would get interviewed and they would look at our notes and we'd say, no, this person's actively psychotic and they're not taking their medication. They need to stay here.
So
And
can
so
you
that's
define psychosis for us?
yeah, so psychosis is a state of just like derealization, essentially. A lot of the times when I would see patients that are dealing with psychosis, it was drug-induced psychosis, and then it would just stay forever and ever, unfortunately. And so that is when they're just not aware of what's going on around them, or the world around them is being perceived very differently than how everybody else sees it. So, yeah.
Okay, excellent. Okay, so no, so okay, so sitting in the court, you're doing this, you're as the psychologist doing the, is this person connected with the reality or not?
Yeah.
And you, okay, so then what else do they do?
Some of them are just like maybe somebody's in there for suicidal ideation
Okay.
and they're like, I'm not suicidal. And then I'm like, your PHQ-9 has you as severely depressed and you said that you want to die and you have a plan. So here's my proof. Yeah.
Yeah, that's called suicidal. Yeah.
Yeah.
Okay.
So
Uh,
it really just depends on the person and like what their presenting symptomology is and essentially what they don't want or want to do about it.
awesome.
Yeah.
Okay, not awesome. That's not the right word, but I
No, I get you.
yeah. Okay. So okay, so then so so that's kind of like the triage part of your job when you're doing
Mhm.
that sort of thing. What would like a day-to-day work life be for someone as a forensic psych person?
So I'm thankful that my supervisor at my current practicum site is a forensic psychologist. They
Oh,
matched
cool.
us because of that. And so she works for the Department of Mental Health. And so what she does is she um, writes the intakes for people that are placed in those hospital facilities after they're like, okay, it's kind of funky. So when people go to jail, they get assessed for their mental and physical well-being. If they're found to be mentally incapacitated, they're usually sent to some form of hospital under the Department of Mental Health. And so her job is to assess those people and then write court reports for the court and then essentially just like say what's going on with them. I worked for a woman for a little bit who did forensic report writing for sex offenders. And so I would help her with her report writing. And it was essentially looking at police documentations that could span from years and years and years and
Wow.
collecting all of that data, providing a diagnosis, looking at the assessments that were done that were measuring for risk. Because the biggest thing is the person still a risk to the community? Are they still a risk to themselves? Are they both? What does the court want to know and how do we tell the court that in an effective manner? And so that's a lot of the times what forensic psychologists do. The easiest way for people to really understand, and it's kind of a weird cliche way to show it, but the Johnny Depp case, the forensic psychologist was his psychologist, I believe. And so she's I don't think she's actually licensed, but she's a forensic psychologist. And so essentially what she was doing on trial, yeah,
Not
what she was
exactly licensed.
I don't think she is. I think that was like the whole thing about it when they were, because we get trained as well to basically stand on trial and like vet yourself because
Well,
when
that's
you're
terrifying.
yeah, because when you're presenting in the court, you know, the defense attorney or whatever is going to ask you questions and kind of like defame you. That's the wrong word, but you need to be
Oh,
able
but
to
they're
like,
trying to discredit your thing.
exactly.
Yeah.
Yeah, so we get training for that because as a forensic psychologist, and if you do want to work for the court system, then you have to figure out how to vet yourself, right? And be like, no, I've been trained in this, I understand this. Um, yeah, I feel like we went on a tangent a little bit.
No, no,
But
but
that's
so that's like in a day-to-day thing, going to court really
yeah,
is a part of your day-to-day thing.
yeah, yeah.
And being it's like I love how confident sounding you are. I mean, I
Oh,
just as your former teacher and seeing your former little self,
yes.
you are such a like you're so confident and just you're doing the right thing. And it's like, sorry, you know, curious. Like it's all curious.
I know, me looking back at when I'm 18 and me looking at me now, I'm like, okay, now I actually know what I'm talking about, which is really cool.
Yeah, and it's like, and but you're like, oh yeah, and then you have an answer immediately, and then you have, and I love how you just throw out these assessments. Well, that's the MRT5. Yeah, we gave that one, and it's 4 to 7,
Yeah.
just so you know. And it's just like, for all of us people who don't know what the acronyms are, but you have a number, you have an assessment, you have that's why this is so legal
Yeah,
because there is a score and there is a representation and there is a meaning and there's a purpose and
exactly.
so like so one of the forensic person that talked to well me last year, she talked about malingering.
Yeah.
How do you deter okay, so explain malingering because I didn't know
So
what it was.
yeah, so malingering is the person faking good or faking bad? And that's actually a really interesting question since we've been talking about the MMPI so much. I have it in front of me, not the actual assessment, but I have a client who I gave the MMPI to, and her within the MMPI, there's like a bunch of scales. I just have them written down here,
Yeah.
and they tell you if they're lying or not. And so for her, it said that her malingering scale was heavily elevated, and so it's invalid. And so we look at that and we go, okay, this assessment is saying that this individual is lying about their presentation. What exactly are they lying about? So then we look everywhere else. I gave her the MMPI because I wasn't sure if she had borderline tendencies or if it was just complex PTSD. Surprisingly, she scored very, very high within the schizophrenia subscales. And so I'm looking at this and I'm going, what is going on with her? Like, why is this happening? And then, you go through the history, and this is why assessments are important, but also should not be used as diagnostic tools.
There you go.
Yeah, because we want to look at it and go, okay, yes, it says that they're lying, but I know my client's history and this assessment does not. So I know, like, even though it says she has very high paranoia, I know why she's paranoid. The test doesn't. So it might be saying that she's malingering because of that. But essentially, malingering is the person lying about their presentation.
Right. And then so one of the cool things is that for the folks at home, the MMPI was tested with a bunch of psychologists that were given cards to present as. Like, okay, present as a depressed, present as schizophrenic, present as, transgender, whatever, present as. And so they trained psychologists who helped write this test couldn't fake the lie scales. So even though I know what the symptoms of schizophrenia are, I would answer as a schizophrenic, but it would trigger that malingering score because it would say this person is trying to present as a schizophrenic.
Mm-hmm.
That's why it has 500. That's one of the
So
ones on
many
myself,
true or false
700 questions.
questions. Yeah, it's a
And
lot. Yeah.
you can't remember what you put on every single one
Yeah. And
unless
also
you're
the
sociopathic.
questions, yeah, the questions are also really weird. Like there's this one question. If any of you ever get the chance to look at it, it's really interesting. There's this one question that's like, I like looking at magazines about cars, or I think my parents lied to me a lot. And then it's like, I hate my mom. I dislike my mom. And it's like, why
Yeah.
are they like these questions are so funky.
Yeah, but and that's the idea is that they're looking at the reliability and iterating testing is it's really fascinating with that.
Yeah.
Okay, so you can tell so by giving these assessments, what if the patient just refuses to do these tests? I mean if like someone gave me a 500 choice test, I'm like, screw
Yeah.
that. I'm not doing it.
So there's like three ways to go around this. You offer the person the test, they take it. You offer the person the test, they don't want to take it. If they are within the court system, you can get it court mandated, so they have to take it. And if they don't take it, they will get some form of like something like that's one area that I'm not too sure about. Like, what if they don't do the thing that they're essentially being court mandated to do, but then something happens. And then with that comes that weird third thing where it's like they don't want to take it, but they do take it. And oftentimes what we see is that really high malingering or like feigning bad, feigning good scale because they just don't care. They're just selecting random things.
Yeah, or the infrequency some
Yeah.
the infrequency score, which basically means they're just putting the Nike swoosh down the Scantron and moving on.
Yep. Yeah. Yeah. Because it's really interesting, especially with this is becoming an MMPI lecture. It's really
Well, no,
interesting.
but it's fascinating because I
Yeah.
mean, a lot of you don't really hear about it. We talk about it in intro for like 2 minutes, and but you don't realize how much it's used as an
Oh
assessment.
yeah.
Yeah.
Oh yeah. Like it's so for her, it was like so the first two scales are like the VRN and the TRN. Do not ask me what they stand for. But hers were
Variable
valid.
response, variable response, VRT, variable response, true variable response.
Yeah, I think
Oh,
that's
yeah.
right, actually.
Yeah.
Yeah. And so for her, those two were valid, which kind of showcases that she was doing it to the best of her abilities. But then we look at that like feigning or those malingering scales, and it's like, no, 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 she's faking. But it's like, but you're also saying that she's true to her presentation with it. So that's what's really interesting about the MMPI. So although
Well,
it says that
that
it's
would
an
be a code for
invalid,
dissociation, just for the record.
yeah. Oh, I'm using her for my comprehensive exam, which is in 2 weeks, and that's
Ooh.
my save. Yeah.
Yeah. Okay, that just had flashbacks from testing and measurement, like my sophomore year or junior year at San Diego State. So so now when you get out, you're gonna have a bucket of debt.
Yes.
So, but that's okay, doesn't matter.
Yeah.
And so what is the job prospects for forensic psych?
They're
Are
actually
there a
looking
lot of jobs
very
for it?
good. Yeah, I've already been recruited 3 times, but I have to keep saying, I'm not licensed yet. I don't have my doctorate. I'm not licensed. Because what's interesting about my program is they let me go straight into the PsyD, and so I could get my master's while I'm getting my PsyD.
Oh, wow.
That's
Okay. Did you finish the master's? Do you have that degree?
yes, I do
Oh,
have my
excellent.
master's. Yeah.
Congratulations.
Which is thank you. And so I'm doing psych associate so I can get paid a little bit more while I'm at my internship. So hopefully we'll see how that works. But yeah, so for me, and it really varies for everybody. My roommate who's also in the same program, she wants to be a correctional psychologist, which is why she went into forensic psych. I want to work for the court system and I want to do not guilty by reason of insanity assessments and like expert witness testimony. And so those are things that are always needed. And it's really interesting because a lot of clinical psychologists just go into the legal sector because there's so many jobs available, but there's not a lot of people that have that specialty in forensic psychology.
Hmm. Okay, so this is kind of one of the last ones because I don't want to hold you too long
No,
here.
you're fine. Yeah.
Um, okay, so how do you manage or how do you go home after working with this poor kid who is been abused and just how do you detach from this? I mean, obviously you have notes in front of you about this person. You are still thinking about this person. You were
Yeah,
probably just writing down stuff about this person before you logged in.
I was, yes.
So so what, how do you leave it and go to dinner?
So I have like two mindsets about it. One of it, very cliche, we have to engage in self-care. Right now I'm on vacation, right? I'm engaging in self-care by saying, I'm gonna take the weekend off and just go have fun, right? But it's also like figuring out that balance. I'm in a trauma class right now, and my professor was like, I want you guys to try when you're making your to-do list for the week, write down the things that you want to do, like the fun things, and then look at the schoolwork you have to do. And that actually helps a lot because
Yeah.
then you're able to really mix the two together. Because what I used to do was I would work from 7 a.m. to 6 p.m. at my practicum site, come home, and then just write case notes for 3 hours and then go to sleep. And at the end of the day, I'd be like, I'm so tired. I wasn't able to do anything that I wanted to do. But now I'm like, okay, work stays at work. Like I keep it there. I don't like to bring it home anymore. If I don't have to, I don't do it.
That's
Like I have
awesome.
to do homework, that's different, right? But like actual work, I keep it over there. But then a lot of the times when I'm hearing these stories about like what my clients go through, especially when I was working in that inpatient hospital, because some of
Yeah.
it was just the most horrific stuff. The way that they would treat me, I would maintain that mindset where it's like, I know they're not doing it because they don't like me, and I know they're not doing this because they have something against me. They're doing this because something's going on with them, and they have nothing else to do. They're so confused and lost in their own stuff that they have not, like, they don't know what else to do with themselves. So that's why either they're treating me this way or they're acting this way. And that's that part. And then when it comes to the sadness aspect, I just remind myself that I'm in this field because I want to help these people. And I
That's
find
really
great joy and fulfillment in doing it. At the end of the day, I love the work that I do. I haven't been paid in the 2 years that I've been working. And my mom gets mad at me when I say this, but I don't mind because I enjoy it so much.
that's awesome. Then you found the right space.
Yeah.
Yeah. And it's like, and that's why, that's honestly, that's one of the reasons that I don't, well, this semester I've had to do more, but I usually don't bring my backpack home from school. I don't, I mean, I have the internet's always around, but
Yeah.
I purposely don't I try not to do work at home because I want to, when I get home, I want to be home. I
Yeah.
don't want to be working. And I think that that's a really good, that's how a lot of people who get really burnt out are constantly trying to do work
Yeah.
because there's always going to be work to do.
Yeah.
And yeah, and so it's just, and my sister is a psychiatrist, and she's going to be talking to us soon as well in the class.
Oh.
And she works for Kaiser in Alvaro Parkway Institute.
Oh, nice.
Yeah, and so she is the resident psychiatrist on staff now there. And she is, I mean, some of the stuff that these folks are in, I mean, this is a lifetime inpatient facility. They're
Yeah.
not getting out.
Yeah.
And it's like she says the backstories of these people are just so terrible. And you start to wonder, it's like, okay, so that's how she detaches because she looks at their history. And it's
Mm-hmm.
funny because she sees people, I love it, you see people as scores on tests, she sees people as balance of transmitters.
Yeah, that's
She's
true.
like, okay, what's going on in their brain to cause this?
Yeah.
And you're like, okay, what's going on the test to tell me what's going on in this? It's just the focus is
Yeah.
really interesting.
Yeah. No, that's true. I actually got really invested in neuropsych because when I was working in the inpatient, had a lot of schizophrenic people, and they were like, "Why am I schizophrenic?" And I'm like, "Well, let me explain what drugs do to your dopamine receptors really quickly." And so I would give like
Yeah.
mini neuropsych lectures to this like room of inpatient people. It was really interesting.
But the thing is that if you're talking to them like they're intelligent, rational adults, there is an intelligent, rational adult in there,
Yes.
and they can understand it. It's just their presentation is a bit wonky.
Yeah. And I think a lot of people within the field that I've witnessed like to talk them down. That's not going to do anything for them. I
Right.
found that meeting where they're at, especially working with forensic populations. Like I remember I was working with an ex-gang member, and I'm like, I cannot use clinical jargon with this guy. We're not going to get rapport. He's not going to vibe with me. And
Right.
so I would like become more casual and conversating with him. And I actually had to write like recommendations for a court hearing for him, which is really interesting. And it's just like
So
we
like
need to
recommendations for the lawyers?
treatment. They wanted to send
Oh,
him back
treatment
to
facility.
prison. Yeah, they wanted to send him back to prison. And I was like, he needs to go to a rehab facility, not he's been to prison already. It did not work because my little insight, my dissertation is on quality of life in prison. So
Ooh,
yeah. So I was like vetting for him. I was like, send him to a rehab facility. He has a substance abuse problem. But sending him to prison is not going to fix anything. You're just
he
going to
can
make
get the drugs in prison just as easily as.
exactly. Yeah. So that's the way that I like to look at it. I look more so at like, how can we rehabilitate rather than reprimand? Because reprimandation within the United States is bad right now. And so, yeah,
But it makes money. It's about the money.
it makes a lot of money. I mean, they're making me money in the future, which is unfortunate, but yeah.
Yeah. Okay. Okay. That's amazing. Okay. I'm so happy that we were able to come and talk to us.
Yeah, of course.
And what was the guy's name? Is it Trevor? No. What was you had the gentleman that was with your group for a long
Oh my
time.
gosh. This was like
The
5 years
red-haired kid with
ago.
glasses. He never finished intro. Sorry,
Nate,
Nate.
yes.
Okay. You know what is he doing now?
He was working with Becca actually.
Oh,
Yeah. But that was at like he was doing accounting for that law firm they were
yeah.
working at. Yeah.
Yeah. It'd be so funny if you guys end up working together again.
I know. That
She's
Becca and
working
I
at
make
the
jokes every once in a while.
just like because you guys anyway. Um, okay. So the last thing is so when you finish and you get your, do you have to go through like the clinical licensure that, okay, so you still have to go through, are you getting your hours and all the clinical practicum stuff to become, so could you actually just set up a shingle and just work with people?
Yeah, if I wanted to, I could do a private practice.
Oh, okay, but I know that's not your speed, but then but you're getting that same, this, are you going to
Yeah,
become
so my
a
goal is
psychologist or
to take,
LPCC or what is
no, I'm
the,
gonna be a clinical psychologist. My goal is to take the
okay,
ethics exam and then the EPPP.
okay, E
Yeah,
triple P.
which again, don't ask me what it stands for.
I can't remember. Okay.
Yeah,
Okay, so cool. And so and is there a Chicago school in San Diego too, or is it just in
there
LA?
is, but they don't have a forensics program.
Okay.
Yeah, that's why I moved to LA, which is unfortunate some days, but yeah,
It's LA. It's
it's
cool.
LA.
You just have to decide where you are and it's cool.
Yes, exactly.
It's different everywhere you go.
Oh my gosh, yeah.
Stay out of what is it, North Hollywood?
I live in Hollywood, so
Excellent. Yeah, we went to not what Universal Studios and we stayed in North Hollywood
yeah,
and
got you.
the sign, says no no ho on it. And when you look at the otherwise, it's oh no.
Oh, that's true. Oh no, I
So
never
like
even thought of that.
we get out of our hotel and it's like, oh no. I'm like, oh,
They're telling you to go home, go
they're
back to
telling
sleep.
us to go home. That's right. The hotel is very nice. Okay, that's all we have time for today. I had to make a bunch of those little what are those little pork things they sell, the Hawaiian sushi things like with spam and rice and seaweed.
Oh, I know what you're talking about, but I don't know what they're called.
Hobby with something like that. Anyways, I
Yeah.
made 40 of them for my son's volleyball team, and I have to go bring
Oh,
them to his team before
oh
this
yeah,
week.
Becca was telling me about the games. Good luck.
Yeah, it's fun. My son's being an elitist bastard. Sorry, son. I don't want to play middle. What? Just play so the
You'll
team
get your
wins.
time. You'll get your time. Exactly.
Yeah. Anyway, thank you so much. It's been
No
wonderful to see
worries.
you, and I'm so glad you're doing so well.
Thank you so much. Yeah. If you ever have any questions, you can email me.
I
Yeah.
will.
Or text me.
If the students have any questions, I'll throw them your email.
Yeah, please do.
Awesome. Thank you so much.
Yeah. Bye, guys.